Hi everyone and welcome back to my channel. So today we want to look at fetal alcohol syndrome. We want to look at everything we can on it, some of the causes, physical and neurological effects, risk factors, and most importantly, how to prevent it. So let's get right into the video. Fetal alcohol syndrome is a condition in a child that results from alcohol exposure during the mother's pregnancy. This syndrome causes brain damage and growth problems. The problems caused by fetal alcohol syndrome vary from child to child, but defects caused by fetal alcohol syndrome are not reversible. Here are some of the symptoms. The severity of fetal alcohol syndrome varies, with some children experiencing them to a far greater degree than others. Signs and symptoms of fetal alcohol syndrome include any mix of physical defects, intellectual or cognitive disabilities, and problems functioning and coping with daily life. Some of the physical defects include distinctive facial features, including small eyes and an exceptionally thin upper lip, a short upturned nose, and a smooth skin surface between the nose and upper lip, deformities of joints, limbs, and fingers, slow physical growth before and after birth, vision difficulties or hearing problems, small head circumference and brain size, heart defects and problems with kidneys and bones. Here are some of the brain and central nervous system problems: poor coordination or balance, intellectual disability, learning disorders and delayed development, poor memory, trouble with attention and with processing information, difficulty with reasoning and problem solving, difficulty identifying consequences of choices, poor judgment skills, jitteriness or hyperactivity, rapidly changing moods. Here are some of the social and behavioral issues: difficulty in school, trouble getting along with others, poor social skills, trouble adapting to change or switching from one task to another, problems with behavior and impulse control, poor concept of time, problems staying on task, difficulty planning or working towards a goal. Here are some of the causes of fetal alcohol syndrome. When you are pregnant and you drink alcohol, alcohol enters your bloodstream and reaches your developing fetus by crossing the placenta. Alcohol causes higher blood alcohol concentrations in your developing baby than in your body because a fetus metabolizes alcohol slower than an adult does. Alcohol interferes with the delivery of oxygen and optimal nutrition to your developing baby. Exposure to alcohol before birth can harm the development of tissues and organs and cause permanent brain damage to your baby. The more you drink while pregnant, the greater the risk to your unborn baby. However, any amount of alcohol puts your baby at risk. Your baby's brain, heart, and blood vessels begin to develop in the early weeks of pregnancy before you may know you are pregnant. Impairment of facial features, the heart and other organs, including the bones and the central nervous system, may occur as a result of drinking alcohol during the first trimester. That's when these parts of the fetus are in the key stages of development. However, the risk is present at any time during pregnancy. Risk factors: the more alcohol you drink during pregnancy, the greater the chance of problems in your baby. There is no known safe amount of alcohol consumption during pregnancy. You could put your baby at risk even before you realize you are pregnant. Don't drink alcohol if 1. You are pregnant, 2. You think you might be pregnant, and 3. You are trying to become pregnant. Here are some of the ways to prevent fetal alcohol syndrome. The first thing we want to look at is don't drink alcohol if you are trying to get pregnant. If you haven't already stopped drinking, stop as soon as you know you are going to get pregnant or you even think you might be pregnant. It's never too late to stop drinking during your pregnancy. The sooner you stop, the better it is for your baby. Continue to avoid alcohol throughout your pregnancy. Fetal alcohol syndrome is completely preventable in children whose mothers don't drink during pregnancy. Next, you want to consider giving up alcohol during your childbearing years. If you are sexually active and you're having unprotected sex, consider giving up alcohol during your childbearing years. Many pregnancies are unplanned and damage can occur in the earliest weeks of pregnancy. If you have an alcohol problem, get help before you get pregnant. Get professional help to determine your level of dependence on alcohol and to develop a treatment plan. This brings me to the end of this video. If you have benefited from it, be sure to subscribe and see you in the next one.